everybody! Today in the studio we have Jean Rintoul, who is a biomedical and otherwise technologist extraordinaire. First up, who are you, and what are you doing with this Spectra imager?
Cool. Yeah, I made this open source biomedical imaging device based on a technique called electrical impedance tomography. And in the past, I've done all these different biosensor wearable startups. So I've been interested in the conjoinder of electronics and how the body works for a pretty long time. From Emotive, I was part of Emotive, which did a Contuber EEG headset.
Yeah, cool.
And before that, I actually worked in defense research doing radar things. But
whoa.
Yeah. And then there was Basis, which was a biosensor wristwatch that was more about the peripheral nervous system and what we can measure with basic sensors from our wrist. And that was really interesting. I spent a few years at Ghazali Neuroscience Lab at UCSF. We worked on this paper about attentional networks in the brain and transfer effects when you play video games.
Oh.
So we had this video game that helped older adults to focus, and that got published in a good journal.
Can I still use it? Because I want that.
Yes. Yeah.
What's it called?
It's called NeuroRacer, and a startup company has grown out of it because what it is it's like a scientifically validated video game.
Wow, cool.
Whereas a lot of other things weren't scientifically validated. This one's really backed up with a lot of studies.
That's rad. And you also were making an app to image people's poop. And you were ahead of the whole microbiome.
I made an app to image people's poop as well. And also a sleep analysis app. So so I was sort of looking at different ways we can get information about the body in a non-invasive way. So, and I also made a startup for a while looking at non-invasive detection of how full your bladder is, which is useful for people who have a condition called neurogenic bladder. It's paraplegics are part of that community, as are some people who've had prostate cancer surgery and other people who've had kidney cancer and things like that.
Wow.
And so my interests are sort of obviously in this combination of electronics and the body, and they keep sort of moving closer to how much more can we find about the body. I suppose we've got a lot of heart rate sensors right now, and they're cool, and you can get a lot of information. Like heart rate variability is awesome, but it would just be amazing if we could get higher fidelity information, and part of that was and understand the body more from an electrical point of view, because we are really just complex circuits, right?
That's so cool. Every time you say that, I flip out. We talked a little bit about this beforehand, and it's just fascinating. So you bring that idea of the body as a circuit to this device.
Yeah.
Right? Like sort of resistors and capacitors?
Yeah. So the way that this works is if you imagine every cell in the body as a part of a circuit, it has a resistive element and a capacitive element. And it's in a big network with other cells. And each of those cells has different properties depending on how big it is, how thick the cell membrane is, and things about the intracellular fluid, and so you get all these different electrical properties that vary based on material.
Yeah, is the capacitance between cells because you have the cell walls and then the fluid between them?
Right, yes.
Oh,
yep.
Cool.
Yep, exactly. So basically we have, so you can probably see little electrodes around the edge there.
How many are there?
And this is 32. So what you do is you can send signals through at different angles, and you basically use all that information at different angles to recreate an image.
Wow.
And it's using the same algorithm that a CAT scan uses, which is called back projection. And it's a classic algorithm. There's other more sophisticated algorithms you can use to model the current as well. But by using the same technique just as a CAT scan, you can recreate an image of the body based on its electrical properties.
Wow.
Yeah, it's not as high resolution in spatial resolution as a CAT scan, but it has it gets different information. It gets dielectric spectrum, so you run different alternating currents at different frequencies, like between 100 hertz and 80 kilohertz, and basically at each
That's a huge range.
each pixel you get a different point, so you can see these differences in materials across the range.
Cool.
Yeah.
And you can see an image of what this looks like on your Crowd Supply page. So this is currently funding on Crowd Supply. Super exciting. You're already pretty well towards your goal, and you still have 30 days left.
Yeah.
So here is the sort of comparison of how this looks compared to the CAT scan, right?
Mm-hmm. So a CAT scan does 256 X-rays to get that kind of image, and this is using only 32 points or electrode points.
Mm-hmm.
So basically, the more electrode points or the more views you take, the higher resolution the image will be.
Uh-huh.
But the downside with CAT scans is that they're like $3 million. You can't play with it or improve it very easily unless you've got that much money just to play with as your hobby in your CAT scan dungeon.
Your Jeff Bezos CAT scan dungeon.
Maybe. You know, some people. Everyone's hobbies, right?
And you're saying it's also harmful because it's X-rays, right?
Exactly. So they don't even do CAT scans on small babies because it leads to cancer later in life. And even as an adult, you shouldn't be getting a CAT scan unless you're really in an emergency situation. You really, really need one. Like, something's about to, like, you've got some sort of water on the brain, you've got something really, really serious, you've got a tumor, something's really going wrong. Because it does increase the radiation levels. It's the biggest cause of radiation in the United States.
In humans.
In humans, yes. So it will decrease over time. But the problem is whether it leads to cell mutations or not.
Right.
And different people may be more susceptible to that than others.
Huh. Yeah. So what inspired you to make this specifically?
So I started with the basic technique. So as I mentioned, it sends through signals at different angles. So I started just by sending one signal through. And I noticed that was pretty fascinating by itself. So this thing has different modes, and you can also just send one signal through. And that gets time series impedance data. And why that's cool is it's different from ECG. It's different from EMG, which you might be more familiar with, which is very popular.
Electrocardiograms, electromusculograms.
Yeah, it's not that. What it is it's measuring this like mechanical change or material change in your body.
Huh.
So, for instance, your lungs expanding and contracting are such a change. Which is different to what ECG measures, right?
Yeah.
Or your heart valves pumping blood. It can measure. So there's lots of work on breast cancer. There's some work on breast cancer as well.
Oh, cool.
So there's this technique was actually developed about 30 years ago. It's outside of the patent zone.
Nice.
Yeah, so why not? But it's in labs, and it's like you use these like really big, giant things of like on trolleys of electrical gear to do it, and it's really expensive.
Yeah.
So just the EEG system that it's based on might be like $40,000 plus. So sort of high resolution current source, another $20,000. So I thought, so this technique, because it's just using AC, like every garden variety, everyday AC currents, which are in the safe levels as well, so you can not worry about sort of hurting anybody with it. I thought, it could be miniaturized, because and that's something that I have a flair with. Because I've been in all these biosensor wearable startups, so I know that's a good thing for me to do, and it's just this fascinating research technique. The way that you test and improve these techniques is actually often in a tank. That's why it comes like with a tank.
Oh, right.
They call it a phantom.
Phantom. That's the name of this type of.
Yeah. So if you wanted to do something like just improve the spatial resolution or sort of look at any object that you put in there, so you could put a piece of fruit in there or other bits and bobs that you're interested in measuring, it gives you this sort of very geometrically
Very stable and kind
stable. Good connection because you have the same surface area exposed on every electrode if you do it in a tank.
Right.
So it has these like different advantages for like what is the pure technique and how good can it get.
What is the weirdest thing you've put in there?
I don't know. I mean, there was this a dragon fruit maybe.
Ooh, cool.
Yeah.
I didn't say the most delicious thing.
Most delicious thing.
And you're able to do this partly because of, it seems like flex PCBs have become a lot more ubiquitous and cheap. Has that helped with your development process in this?
Yeah, it has. It uses a flex PCB for the electrodes, which I think is a really good. I'm just going to take the lid off so you can sort of see the PCB in there. So this is like a nice flex PCB, which is just connected with a FPC connector there. It's actually a very neat solution to a ring of electrodes. So there's like different approaches that you could take to doing electrodes. If you want something that's very extendable, you might have a big cable or with separate electrodes that you could sort of stick on your body or like a cow or
like these like wires on and stuff, but
right.
It's so tangly and
that's right. So this doesn't get as tangly. So you could do it the tangly way, which has pros and cons, or you can do it this way, which is just like chook.
Like in this case, you're going for precision instead of like being able to stick them anywhere on the
yeah
critter or whatever.
It's very precise. So because it's in the flex PCB, you have the exact known distance between each electrode.
Yeah.
So if you're trying to sort of like figure out where something is, that gives you like a great advantage. There because you also know the sort of the diameter of the tank.
Yeah.
And you actually use that geometric information around the outside when you do the image reconstruction as well. So based on knowing where the electrodes are and knowing how the signal is impeded in its path it's taken, you get these different results.
So are these electrodes just little copper pads basically, and then they each have their own wire connected to it?
That's it.
Neat.
Yeah. And I feel like this should be used more for this kind of biosensing a whole range of biosensing applications. EMG, ECG. It's very simple.
And you could easily make tapes of different lengths that would easily plug into the same device.
Yeah.
I guess you just have to be able to make it expand like the port connector or whatever, but that's trivial.
Yeah, there's like a I/O expander, which I think I'm also going on
cool.
Crowd Supply that like helps you
Let's take a look.
expand out like that.
Expansion kit.
Yeah, so people can expand out however they want. Like one area that's actually sort of I think is quite an interesting area. Have you ever thought that you can't put a horse in a CAT scan very easily?
I have not thought that. I guess I'm not that familiar with CAT scans.
Yeah, I mean, like a CAT scan is like this like little thing, and horses are standing and they're on farms.
Yeah.
How do you say you have a really expensive racehorse?
Yeah.
And you want to sort of they need to go and get tested. They have very limited options currently. So yeah.
I have no idea how that works.
Yeah, because they're so big, right? You have to like sedate them and like hold them off. And
and you can only get like an image of something this big. It sounds like.
Oh, with a CAT scan?
Yeah.
Oh, I mean, they can come in different sizes. I think they have veterinary CAT scans, but they're like
massive,
very massive, and you have to drive
like
a long way.
You just brought in your backpack.
You could bring something like this in your backpack.
Cool.
Yeah. So basically, this technique, modeling the body as a circuit, and then sort of basically back solving from there. It seems really interesting. It can even be in a wearable form factor. So I was sort of like, so we've done all these things in wearables. We've done heart rate and accelerometry, and we've done EEG, and it's cool. But where do we go next? And I want to like go somewhere that's safe, as well. So. I know there's like a whole lot of TACS and TDCS work, which is super fascinating.
We were just talking about the Plato thingamajig, which is a new TACS one that's coming out.
I haven't heard of it.
Just another one of those focus thingies. Like the Hum is like this, the one that does TDCS. And It's so interesting to see that becoming real. But also, there's more danger because you're putting current directly into the skull.
Yeah, so that's at a much higher, that's like a milliamp current rating, and this is at a microamp.
Nice.
So orders of magnitude different. So that makes it much safer, which is a good way to explore the sort of the data coming out of our own body. And there's like a whole bunch of labs that are exploring this technique as well.
What are they using it for?
Yeah. So one classic set of studies is on babies in NICUs, their lungs. They can't put them in a CAT scan because it'll lead to cancer later in life for babies. So if they can put this around their lungs and they can measure their lungs expansion and contraction continuously because their lungs are like the last to develop. That's a good application. That's in clinical testing.
And I bet it's way more comfortable and sort of comforting for the baby as well.
Oh yeah. Yeah, I think they have to like sedate the little babies to put them in those things and stuff. Yeah. So if there's like they can make this out of a very soft material, and so it's like and they can stay wherever they're happy and yeah. You can also sort of look at it on like in a petri dish, like cellular assays as well. So there's sort of some lab on chip work going on as well with it.
Huh. I could see these being using. I have some friends doing stuff with like open ROV and stuff, and also there's a thing that picks up lionfish out of the sea and like puts them in a tube. So you could also like image to make sure that what you have is. I mean, I guess there's way easier ways to do that, but like you could still use it for ocean science and whatever.
Right. Yeah, sure. Yeah. There's some cool work on wound healing. So and pressure ulcers or bed sores. So. You know how like some people they like have to lie in hospital beds a long time and they get these pressure sores. It would be really nice to know that they were getting them before they got them.
Yeah.
So, right?
So do they start under the skin?
Yeah, and if you can see under the skin, that's really handy. And there's some really awesome work on this showing how you can like see under the skin before the pressure sore is visible. So that's really helpful for people who are at risk of pressure sores.
And what can you do in that case? Just like make sure they move around a bit more? Or?
Yeah. So massage the skin, make sure they move around, take the pressure off that area because they're obviously just like.
And prevention is so much better than like treatment too.
It is.
Oh, that's so cool.
Yeah, and it'll reduce the risk of infection and things like that. Or like maybe after surgery if you want to monitor for hemorrhage as well. So, although it looks like you sewed it up. Maybe something else is going on under the skin in the first 24 hours, which are like a high risk period in some serious surgeries. So that's another interesting application. There's also neuroscience applications as well, which are sort of on the sort of cutting edge of research and done in rats. We're talking about mice. There's some
really tiny ones.
Yeah. Like you can make this array any size. Obviously, it just happens to be the size. So they put them on rat brains, ECOG arrays, and they can actually sort of reconstruct action potentials, which is really cool.
So you can see the neurons firing.
That's right.
Wow.
Which is kind of better than EEG, because EEG is just like sort of getting this sort of cortical voltage measurement, and it's hard to figure out what it is and whether it's actually correlating to this particular area. So this gets the spatial localization as well, whereas EEG doesn't do that so well.
Right.
So there's some cool work on that, and they've also put it on some human heads and correlated it with event-related potentials. So
like seeing a particular thing and keying that to a
Right, to an event with these global kind of current changes. So it's like, so this, I mean, it's called current source localization. It's like, how do you figure out like, where the currents are moving in the brain? And it's a very small signal that they have to pick up. So that work's going on, and it seems interesting, and it's sort of, there's some papers out there on that.
Wow.
And gestural recognition. Or for people who need prosthetic limbs, so we've been using EMG a lot so far, right? So if you wanted to like get a cross section, there's actually there's these people, I think it was CMU, that used EIT for this. And
EIT?
That's electrical impedance tomography. It's the name of this technique. Yeah, and they did this resistance map of a cross section of the arm, and obviously as you like do different hand gestures, your muscles in your arm sort of change locations.
Yeah.
You can just like feel it, right?
Yeah.
So it's like it has some interesting applications on that side as well for both, say, like human computer interfacing, and also for helping people that would use it as feedback in prosthetic limbs.
Yeah, and you can just leave it mounted inside the limb. Probably.
If you wanted to put it inside, but maybe you could just leave it on the outside.
Right,
even.
yeah.
But it's always going to...
I mean the prosthetic, but yeah.
Oh, yeah. Everything definitely always works better if you can jab it inside.
Oh, yeah.
Because you get like a much bigger signal.
Yeah.
But,
yeah. Well, shall we try and do a live demo?
Oh, okay.
Cool. So now you're putting the shot glass in. Oh, and it's already kind of updated. Oops. Oh, is that the sensitivity?
Yeah.
Cool.
And then you can see where the shot glass is positioned just by using the AC current. We can move it to
That is indeed where it is.
That is indeed where it is. And then we can move it to the other side. Boop. And then give it a second and it'll update to the other side.
So you have, oh wow, yeah. So you have a couple of different sort of resolutions and related speeds, right?
Yeah, so this is the middle resolution.
Uh-huh.
How about I switch it to the faster resolution?
Cool.
So the faster one gets a little less spatial resolution. So you just go back to the control screen and go,
oh wow. Are those the individual readings from the sensor nodes?
Exactly.
Cool.
Yeah, so you have direct access to the actual raw impedance values.
That's really neat.
So you can do anything you want with those. So you could save them off and play with algorithms, which, by the way, can actually give you a large improvement to actually tune the algorithms to like whatever thing you're wrapping it around. So now we go to 8 electrode. Pop this in. And auto scale. So this one's lower resolution.
Oh yeah. It's nice that you have auto scaling though.
Right.
So now you're just moving it around the
Right, so you can just move it around the tank. And keep going.
So the dark spot is where it's more massive.
Yeah.
Or resistive. Cool. And what does the water do in helping with this? Is it for conductivity?
Exactly. Basically, it's for conductivity. Because you're sending currents through, you have to have, same with ultrasound, you need to minimize the acoustic impedance of the interface.
Huh.
And then let's just try the 32 electrode mode as well. So this one takes about 30 seconds per update.
This is the one with sort of all the electrodes. Wow, yeah, that's a lot of data.
There you go. Yeah, it's like 862 points.
Wow. Yeah. Oh, because you're getting all the
yeah,
combinations of them. Cool.
Let's go boop, 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 boop. So just wait for it to baseline first. So what I'm doing here is I'm taking a baseline of just the water sitting still in the tank. Then I'm doing a difference image by putting the object in. So just put it like this.
I like the sound effects necessary for science. And the histogram there, what is that?
That's showing the distribution of the impedance points. So you can see what values that it's read in. In this case, you can see that let's just change the scaling so you can sort of see it a little bit better. So that's where the cup is in the tank.
Cool.
And so you could do this on anything. Yeah, what's nice about it is that there's this technique is really low cost. You can mass produce it. It could be a wearable, and in some instances it is a wearable. And yeah, imagine if biomedical imaging could be made more accessible. Like an MRI needs a helium quenching chamber and
Wow, yeah.
and dedicated technicians. If we could do this in a way, so it's just so if we could do this in a way where we could actually make it accessible to more people, make it generic, like it could be like a preventative scanner that like people do like a first pass scan, and that means that they, so this got a little bit from both when I was in the previous position and this position. So you'll see in the next update it will just be over there. So basically if we could make it so that we could do medical imaging really cheaply, and there's all these different interesting techniques which are quite safe to do it with, then we'd all have better health. We could just use it preventatively.
Yeah.
We could do like a weekly scan and just look for changes. So what you want to keep an eye out, is like, I don't know, if you want to know if you're getting a tumor or something, right? So it would be wonderful to just do like a preventative scan. You could go to Walgreens, hopefully not like Theranos at all, but you could just go somewhere.
Yours already works, so I feel like that's one thing you have over Theranos.
Right. Yeah, so here it is. It does this thing. It can be improved on. And if we wanted to make it more accessible, help people even in the third world get a hold of some sort of medical imaging, I think it would just be awesome if people wanted to create a movement around it, kind of like the Raspberry Pi, but for medical imaging.
Yeah.
So the point is that doesn't have to be in a glass castle somewhere.
Yeah.
It's something that we should play with, and then it has these really stunning repercussions if we do.
And then since it's so versatile, people can popularize it and help bring the cost down by using it for other applications as well.
Right.
Super cool.
So, there's sort of like different variations of this technique that you can sort of use as well. Like I can also show you the lung imaging. Impedance time series data as well.
That'd be really cool.
And you can see the breathing expand and contract.
Do you have like a recording or something? Or
I have a recording, or I could set it up.
Oh, let's set it up. Yeah.
All right.
So one of the cool things about this is that it looks like that software is in the browser, right?
Yeah, you can also just use it standalone as well, actually. So you can just use it as a standalone app.
Nice.
So yeah, it can just open as a standalone app as well. So there's like a couple of different ways that you can use it. So it's designed for sort of people who want to hack at different levels. So not everybody wants to necessarily get very involved in the Python and install the right libraries, although there is a simple like install file to do that. So if people don't want to sort of do that, say you're a doctor or something, you probably just want to actually get the data and look at the data and what you can see in the lab situation. You don't want to mess with Python. Right. So what you can do is just use this like easily downloadable one and get the data that way. So yeah, and then if you actually want to sort of like install it and have a look at the algorithms, you can do it that way as well.
Neat. And you're just attaching those sensors with Scotch tape.
Currently, yeah. It's probably not. I've also got some medical dressings here, but I thought I'd just do it. That would be better. But
And you have this conductive gel as well.
I have conductive gel, but I'm also currently not using that. We'll just see how well we do with this.
Cool. Oh, and there's a mailing list people can join. And you also said that you do product development consulting? Cool.
Yeah. So if people want product development consulting, I do Python, data science, algorithms, development from sort of data pipelines. Like a lot of people need improved data pipelines for whatever it is that they're testing and sensing and recording, to EE design as well.
Neat.
So I sort of span a few different things there.
Is the best way to contact you about that through your Twitter, Rintoul, or your website maybe?
Website would be perfect. Or email.
You have all your little links here. Fantastic. Oh, I was curious what the chips on here are. So they're multiplexers.
Yeah.
Huh. Interesting that you have an accelerometer in there. Whoa.
Just wait for it to rescale in a little bit.
Yeah. It does look like we're seeing a regular... Wow, that's so cool!
Breathing in.
Wow!
And breathe in again. A little breath. See. Big breath. So why that's interesting is this is my lung volume.
Wow.
Little one. Little one. So this is different to AMG and ACG. It's my lung volume.
Mm-hmm.
So every breath, how big that breath is. And I'm taking like little funny breaths as I talk.
I guess I'm confused because it almost looks like it's backwards to me as an untrained person. Like it looks like the impedance goes down when you breathe in.
Yeah, I think that's the way the electrodes are, based on the direction that electrodes are attached.
Of course, because if you put positive
and if
versus
you put
negative...
put them around the other way, they will be the other way around.
That makes so much sense.
Yeah, so that's breathing. So that's sort of cool that you can... So that's showing, measuring a material change over time in a body part, my thorax. So, yeah, I feel like there could be a lot of cool things to do with meditation.
Yeah.
Like, we've got heart rate variability in meditation. Breathing.
Heart rate variability is one of those really interesting ones because I only learned about it recently, but the fact that it's such a solid indicator of health and stuff. And I actually noticed it while I was meditating before I knew that it was a thing. I was like, oh, my heart goes faster when I'm breathing in and slower when I'm exhaling. And to find out that that's like an actual thing. So how long have we known about that? Do you know?
Quite a while. So
Pardon.
yeah, so I started getting into it when I was at Basis, actually, and I was like reading all these papers about it, which was this biosensor watch place. And it's really interesting how it relates to the sympathetic and parasympathetic nervous system and the vagus nerve activity. And there's other findings like in meditation which are scientifically backed about types of breathing that you can do. So there's prana meditation, which is prana means the breath. And if you breathe at a certain rate, like take these like deep, relaxing, I guess, whatever, 0.1 hertz roughly, 10 per minute types of breaths, you basically enhance your parasympathetic nervous system or put the amplitude up. And you can see that in the heart rate variability. So if you can sort of help people learn how to breathe properly, like taking breaths from their entire lungs instead of just, when you're nervous or something, you might take little upper lung breaths or something.
Little like rabbit breaths.
Little rabbit, yeah. All right, I'm gonna take this off.
Wow. Thank you for being willing to tape yourself up for the demo. That's so cool.
And obviously that like expands to any change you want to monitor in your body. Say bladder fullness.
Right.
So anything that you want to monitor between some electrodes that changes in some way that you can measure with by its dielectric spectrum, you can do. So maybe you could try the stomach area or something, because that's an area that fills up and unfills. And your bladder, the easiest way to try it is actually while you take a whiz. Right?
Because you're watching it in real time.
You go from full to empty, right? and you don't want to wait around. You just want to see it right there and then. And this is like an example of like finding the electrical properties of the cell.
Neat.
And I think I have it on the main crowdfunding page. There. Ooh. So this is actually kind of cool. So this is when you send different frequencies through.
Oh yeah.
So if you send different frequencies through, you get a spectrum for different objects. So why this would be cool is if you want to identify an object is present.
Is that because they have different resonant frequencies, or?
they have different dielectric spectrums.
Oh, right, yeah.
So let's just say we could start with a sweet potato and an apple, and like the sweet potato has a spectrum, and this is on different days. So this is just to say that it's repeatable. Okay,
Oh,
I just
cool.
don't like and then there's the apple, and it has a different spectrum, and you can see that the apple looks like the apple on repeated occasions, and the sweet potato looks like the sweet potato. And why that's cool is that means you can identify where they are in space.
Yeah.
So let's just extrapolate that to some biological thing, like a tumor.
Yeah.
That's basically what they're doing in the breast cancer studies. They send through different frequencies, and they get these dielectric spectrums. And this is all totally safe, and it's like, what is the, like, and you can see this is the material spectrum of a sweet potato.
That's so cool.
This is the material spectrum of an apple. This is the one of water. And that's what they do in the breast cancer studies to find where the tumors are. So this is actually like the right time, at least for me, to sort of give it to the world. Because I think it's a great technology, and I think this is actually the way to inspire people to try this thing. It's actually something that you can play with and experiment with yourself. I was sort of curious to see if I could actually do it.
Yeah.
Because it's like a personal test, right? It's like,
yeah.
Can I make a biomedical imaging device?
Have you made, like, you've worked with companies that made wearables and things before, but have you made your own product before?
No.
Wow, cool. So exciting.
Yeah, so that was the other part of it. I mean, I made the poo app.
Right, yeah, but that was like software though.
Yeah, that was like in a week, and I was yeah. This was the other personal challenge for me. I wanted to make a product and try to take it through a product life cycle. So I want to this is in a very solid state as it is. There's other things that you could do, but it's I can say it works. It has software, it has firmware, it is all open source, and you can see it and reproduce it. Yeah, so I wanted to take a product from experimental conception, and I started with an 8-electrode one, just the 8 electrodes, just to see if it kind of vaguely worked, and it did. And then I sort of thought, I'll do it with 32 electrodes.
What did you start testing it on at first?
Just the tank. So the tank is like, the Phantom is the stereotypical model, and this is like how biomedical imaging is developed, and it's like, oh, you do it with a Phantom. You can also use it for industrial things too, like if you want to, like, say you came from a cold climate, you didn't want your pipes to freeze.
Right.
You could use it to measure water flowing through pipes. Another idea would be batteries. You know how there's like charge distribution and there's different chemicals in a battery.
Yeah.
Like how are they distributed in your battery right now?
Yeah. Well, that's awesome. So you're currently funding it on Crowd Supply. You also have a live stream coming up on April 24th.
Yes.
25th?
Yes. Yes. April 25th. On Crowdcast.io, there'll be sort of a webinar giving a description of the project, and also a question and answer session for those people interested.
And we'll put a link to that in the description to this video, as always. Cool, so go support this on Crowd Supply. You've got at this point, about 27 days left once this goes live. Thank you so much for coming in.
Yeah, thanks. It was a pleasure.